We'll go ahead and get started. I don't really need to introduce our speaker today. Dr. Arnold's going to talk about new synthetic drugs that we're seeing. Now, those of you that know me and have done trauma with me, if you've ever been with a head injury where we can't figure out what's going on with the guy, you know that the first thing I want is the alcohol. I don't care about CBC. I want alcohol. I want the drug screen. We're moving into an area, however, where these things aren't as useful. And these are the drugs Dr. Arnold's going to talk to us about today. So, Tom?
Good. Thank you. Yeah, I think it's an appropriate audience to talk about these things, since the same type of risk-taking behaviors that many people who do this sort of stuff are engaging in leads them to also coming in as trauma victims and trauma patients along the way as well. So not unlikely that you guys will have people that have experienced this sort of stuff on your service. And we're going to talk about three different relatively new synthetic drugs that are out there and give you a little bit of background about them and hopefully a little bit more how to maybe deal with them just slightly. I'm not going to go heavy into management, but a few tips. I want to start just by explaining the Poison Center system. And we are, myself and Mark Ryan, who's PharmD over at the Poison Center that's on Wilkinson Street a few blocks away, run the Louisiana Poison Control Center. We're one of an association of 55 centers across the country that provides poison center services for the entire United States, Virgin Islands, and Puerto Rico. And so a lot of the information that I'm going to share with you today was gathered through the cooperation of all of these centers across the country sharing their data so that we can get an idea of what's going on across the country. We send our data to this National Poison Data System, NPDS we call it. As soon as a case is closed that's been reported to the Poison Center, that data is uploaded to the cloud, and it is immediately begun to be mined by people at the AAPCC, the Poison Center organization, and the CDC, looking for trends and outbreaks and that sort of stuff so that we can kind of hopefully try to intervene where we see trends happening in certain types of drugs of abuse and that sort of stuff. So a lot of the data that I'm going to present comes from that. I'll start with just a little bit about this synthetic or designer drug phenomenon. The reason why people do this, they do this for just to avoid provisions in the laws. You can't say that, you can't make a law that says every drug that causes euphoria is illegal. The law is such that you have to name the particular elements and compounds. And in some instances you can say, and everything just like this or similar to this, but you really need to, in order to do that, you need to have the particular compound. So if they modify the compound, they can skirt the laws and get around it. So they make derivatives of existing drugs, modify the structure, or find a drug that has a similar effect but just is a totally different molecule. Been around for a long time. This is not new. In the 1920s, when heroin and morphine were banned, people started trying to get replacements for that. During Prohibition, replacements for alcohol. In the 60s and 70s, people were experiencing making analogs of PCP and LSD. But the term designer drug really wasn't coined until the 80s when synthetic opiates started to show up and some of the amphetamine, people started modifying the amphetamines and stuff. So, and it was this period of time when the federal government came in and used a tool called emergency scheduling, where they immediately could make a product Schedule 1, which was, there's no legal, legitimate use for it, and to help get that stuff off the streets. The 2000s, now our time, all these things are coming down the pipe. We're going to talk about cannabinoids, the cathinones, and the synthetic opioids. We could spend more time talking about these others, the kratom and crocodile we've already had a little discussion about. First, let's talk about the synthetic cannabinoids, K2 and spice. This is John William Huffman. He was a organic chemist at Clemson University in the 80s doing federal government-sponsored research on cannabinoid receptors and synthesizing molecules that interacted with the cannabinoid receptors in our body. Now, it may be a surprise that you have cannabinoid receptors in your body. There are actually several of them. The druggies will say, well, there's proof right there that God meant us to smoke marijuana. But he was looking at making molecules that interacted with these receptors, and some of them blocked them, and others of them were agonists to these receptors and actually activated these receptors. And so he, being a good scientist, he was publishing his work in legitimate journals. People over in Europe, Germany, caught on to his research, started reading his articles, and said, hey, man, look, he's giving us a recipe for these cannabinoid receptor agonists here. Let's make some of this stuff. So in the early 2000s, they started producing this stuff. It started in Germany, but then spread quickly to China and other places after that, and started marketing this as a synthetic marijuana. The main names that are known by are K2 and Spice, the two brand names that you'll kind of see. And this was actually a liquid formulation that was then sprayed on plant material with the intention that that plant material was then smoked to then volatilize that liquid material after it dried and to give the effect. So a little explanation. I'm not gonna call this synthetic marijuana because that's a misnomer. The actual term should be cannabinoid because it activates the cannabinoid receptors. And in the plant material, it's marijuana, delta-9 THC, that is the active ingredient that we're commonly see. Another relatively inactive ingredient, cannabidiol, has got a lot of press recently as well. But the synthetic cannabinoids don't come from plant material at all. There's no basis for starting with that. They're created totally in the lab with synthetic, with chemicals, and so it's really not synthetic marijuana. The molecules are somewhat fairly different enough that it should be more properly called synthetic cannabinoids. These are some of the packages that we've had pass through the Poison Center, and maybe we'll get some good photos of them. You could buy this stuff off the internet not too long ago. I think if you try to buy it now, unless you have connections in the dark web, it's a little more difficult. And I would say don't try that at home because you may get somebody knocking on your door. These first hit us in the United States in about 2009. Missouri's tended to be where all the cases first started. I'm not exactly sure how that happened. But they started popping up, and we were seeing lots of these types of symptoms: paranoia, agitation, psychosis. And the reason why they were so popular was because they did not show up on a routine drug screen. A drug screen tests for THC, and this is different enough than THC that it didn't show up on those. And I'll just say for a moment, in 30 years of practicing medicine, I can probably count on one hand the number of patients I've had come in sign into the ER with the chief complaint of, I smoked a joint of marijuana. That just wasn't a big chief complaint, you know. But when this stuff came about, there were people signing in left and right. Paranoid, agitated, all sorts. I had one woman just said, just let me stay here till it wears off. I'm scared to go outside. Just really bizarre behavior going on from these people because supposedly it has 2 to 3 times the potency of even the most potent marijuana that's out there. So we started seeing a lot of these people showing up. You may remember back when Honey Badger was at LSU, a few of the players got busted because Les Miles added a test for synthetic cannabinoids into their routine screens and caught a few of them that were doing that. That made national headlines. So it didn't take too long. The federal government started catching on, and there were 5 cannabinoids that were identified from just testing, and so they were able to use that Emergency Powers Act to make those Schedule 1s and start cracking down on the sale of these things. And there are several states that had already made some others illegal. These were the original 5. You'll notice some of them are called JWH and then a number behind them. That's for John William Huffman. That was his, and that it pisses him off that those things go around with his name on them. He was not intending to do that. But those were some of his and then some other ones that were already there. So these were made illegal in 2010. This is the list of currently available synthetic cannabinoids. There are over 300 of them. You might recognize some of the names you've heard in the press: Fubinaca, Chiminaca, and here's the John William Huffman series. It's probably 15 or so of those that he produced and have been replicated. The people who produce this stuff and send it out on the streets have said, go ahead, make them illegal. Every one you make illegal, we've got 6 more on the shelf ready to replace it with. So it's a cat and mouse game trying to keep up with the DEA, trying to keep up with the producers of this stuff. And here's the other thing. Several of these have actually ended up causing cases of renal failure, strokes, other bad things. These compounds are taken off the shelf are not tested by anybody. They're just shipping them out to their dealers and putting them in little packages and sending them out. And so if you change enough molecules, eventually you're going to get a molecule that does something bad to somebody. We've seen several examples of that. And that's my fear, is that we're going to continue to see that as they continue to modify these compounds. There was a spike just a couple of years ago. This was in NBC News in June of 15. And apparently it was about the time when whoever was producing this stuff just sent a lot and flooded the market over here with a bunch of them. But just in that one period of time, they said calls to poison centers had tripled in a 1-year time period. And this data that they got from mining that data that goes to the poison centers, to the CDC, that there were 48 states that reported receiving 3,572 calls related to cannabinoids, a 229% increase from the previous year. And they did note also that some states, us being one of them, had already begun to take state action on cracking down the sale and outlawing some of these things. This is a graph that accompanied that article. The dotted line is 2014, calls to poison centers related to synthetic cannabinoids. And this is the spring of 2015. Where it peaked. Apparently, we speculate from an onslaught of new product being available. So this is sold as potpourri or herbal incense or all sorts of other names for them. Here's Scooby Snacks, a popular one. Kind of goes along with the munchie kind of thing. And again, it's just this vegetative material that's able to be smoked, and it has the cannabinoids sprayed on it and then allowed to dry, and then that's rolled up and smoked. Where is it sold? Just about anywhere. Head shops. Anybody know that there are head shops in Shreveport? Anybody? You know where they are? Yeah. We'll show that in a little bit. They were selling these out of truck stops. They were selling them everywhere until finally we started able to be breaking down, getting more enforcement on that. How is this done? This is always smoked. This is not snorted. This is not eaten. It's not injected. It is always smoked. I guess you could do those other things, but you're not going to probably see the effects. So this is the way this one is done. What do we see with it? Some tachycardia, hypertension. The ones that would bring the people to the ERs are these down here, these extreme psychosis and agitation. If there's any good thing about these, is that generally the symptoms were over in several hours. A few hours later, they were gone. This was not the prolonged effects that we're going to talk about later when we talk about bath salts. So generally, these are relatively short-acting in the big scheme of things. Again, doesn't show up on routine tox screens. So they were advertised as legal highs. You need a GC mass spec generally to find this stuff. But I will warn you that most pre-employment screening now are getting smart enough to start looking for this sort of stuff. So it is coming to a drug testing facility near you, I would assure you. Here's one of the pictures. Spice Gold. One of the ways they would try to get around the laws, one, they would talk about it not being for human consumption, but two, they would say not for sale in the United States. And thinking that they could skirt the laws that way, and of course it's always all just a muse. This is stuff that came out of South Louisiana, NOLA, New Orleans, Louisiana, Diamond, NOLA, Diamond. A lot of times they kind of take on the flair of the local community and the packaging for these things. This called it aromatic potpourri. The clouds, the bath salts were famous for one called Cloud 9. Well, this is Cloud 10. This is a synthetic cannabinoid, and it says legal in your state. Mr. Nice Guy potpourri. Then this one came out, no more Mr. Nice Guy, triple strength herbal incense. And again, it says at the bottom, it says product is not for human consumption, right? So it's wink, wink. You're not supposed to be ingesting this stuff. Even some false advertising. We had this product sent to us to send off for testing, and it says on the label, does not contain, and they list those 5 ones that were originally made illegal. But when we sent it off for testing, guess what? It had those products in it. Yeah, absolutely. Here's some out of Colorado, the original Chronic. Aromatic incense, not for human consumption. And again, it says does not contain the following chemicals, but again, they're not very truthful when it comes to that. The latest is these, the new word, the code word is an organic sachet. So they have this, here's Sky Pilot sachet, and you'll see these other, where it talks about an organic sachet, 6 cents. So I was driving by my favorite head shop in Shreveport. This is on North Market. I see there's some familiarity with it in the back row there. You're going to have some surgery residents peeing in a cup later. And my other favorite one is just it's on Stoner Avenue, though. What a better place to have a head shop. This was out front of that one right there. Sachet Potpourri, best prices. All right, so that's enough about synthetic cannabinoids. Let's talk about the bath salts for a minute. Totally different. And these are not the crystals that you used to pour, your mom would pour in her bath to have a nice, luxurious bath. I always get asked the question, why do they call it bath salts? And the only answer I can think of is that if they called it synthetic methamphetamine, it probably wouldn't get through customs at all. But if you call it something else, so they call it all sorts of things. This is where it comes from. It's from a plant, the Catha edulis in East Africa, where there they have a habit of chewing on the leaves of this plant every day to give them a little bit of stimulation, much like people in Colombia do with coca leaves, and much like you guys do with your monster drinks or your coffee. They're not walking around crazy on this stuff. They're just getting a little bit of stimulation out of it. So these things act, the toxin in here is called cathinone, that is the basic structure. And so these, and it acts like an amphetamine. So it's an indirect sympathomimetic. So they take this cathinone, and just like people did with amphetamine back in the 60s and 70s and started modifying the molecule, making methamphetamines, different ones, they've taken this basic structure and modified it to make all these different types of molecules, methcathinone, mephedrone, MDPV. And so basically what these all do is they're long-acting amphetamines. A normal amphetamine half-life is relatively short, in a few hours. These things would be hours to days half-life, so long-acting amphetamine-like stimulants. So these started getting popular in Europe in the early 2000s. We didn't see our first case until July of 2010. Now I want to tell a little bit of story about the Louisiana experience with bath salts because we were at ground zero of this stuff when it hit the country. About the end of September 29th of 2010, our night specialist at the Poison Center, we have somebody answer the phone 24/7. They're all nurses or pharmacists. Our night specialist called myself and Mark Ryan and said, I get doctors calling me with these people that are just psychotic and crazy, and they're talking about bath salts. What the heck is that? I looked at her and I said, I don't know what you're talking about. we didn't know. So we put a call down to the DEA in New Orleans. We have connections down there. And they laughed us off. They said, we don't know what you're talking about. So our night specialists kept getting these calls from ERs all across the state, and these people were just crazy. And so about 2 weeks later, we called back the DEA, and this time it was on their radar screen. They had heard about it, they were onto it, and they very much wanted our help in identifying cases. So we were able to get them to send us samples. No more comment about that. And also get from the hospitals, get them to send us a blood tube. So we were able to send product and blood off to a connection doing that did GC mass spec for us, and we were able to get confirmation that what was in the product was the stuff that was in the blood. So that was very useful, and the DEA started working on that very quickly to begin to work toward making those products illegal, because they were selling this stuff all over South Louisiana. We'll go in that in a minute. This is the first one that was most popular, Cloud 9, high-quality bath salt. And again, on the back it says not for human consumption. It says it has Epsom salts and sodium chloride. It's all a bunch of lies. This is just to show you how much we were the epicenter. This is the number of calls to the Louisiana Poison Center by month, and to all the calls related to bath salts in the country, or in the same month. So this is summer of 2010 through early part of 2011. We got our first call on September 29th. At that point, there had only been 20 calls in the country related to that. And we got a pretty good share here. In November, we had 37.5% of the calls in the nation were coming to our center. December, we got 61% of the calls. 110 of the 180 calls all across the country were coming to our center. It was happening in South Louisiana. And we'll talk a minute about why that was. But you notice they kind of drop off here because through our work with the DEA, we were able to get, on January 6th, I believe it was, an executive order from the governor banning the substances we had identified already, and they started shutting down these head shops and truck stops and where they were selling this sort of stuff. The day after our ban went into effect, I got a call from the medical director at the Poison Center in Alabama and said, "Tom, what the hell is this stuff?" It immediately gone out of state to the next level. So this was our ban. We worked with the governor and the DEA, identified these 5 substances that were early on, some of the main ones that were there, and within less than 100 days from the first call to our Poison Center to January 6th, we were able to get an emergency ban done. So I thought that was pretty cool to be able to cooperate with the DEA like that and help make that happen. They gave us a little bit of credit here at the bottom in their announcement. They said, contact the Poison Center if you had exposure to it. So again, it's still a cat and mouse game. Just like those number of the synthetic cannabinoids, these things are multiplying like crazy as well. They've got tons of those in the pipeline, and so it's a constant battle to keep up with them. This is how they're packaged, usually little small, pretty little boxes. This is called Lady Bubbles, 250 milligrams. It has this kind of clumpy powder consistency. Smells like sweat socks, like dirty socks. It really is not appealing whatsoever, but that's how it comes. This is, I know you can't read this, but this is a report from the Homeland Security where they reported capturing a shipment of 13 pounds of MDPV, one of the bath salts, on a ship that was in the port of New Orleans from China. And so they speculated that that's where this came from. So that's probably what happened. The first shipment that they didn't get got distributed in somewhere in South Louisiana, and they started just putting this stuff in little packages and sending it out. Can you imagine if you have 250 milligrams at a time, and you have 13 pounds of that to distribute? How much money you can make off of that? So anyway, that's probably what happened and why we were in the midst of it. This is the cathinone molecule, and you can see how they just manipulated it very minute manner to get these other compounds that all had slightly different effects, but all kept the properties of the long-acting amphetamine stimulation. This is the cathinone again. Here's methamphetamine. You see how very, very similar it is to just methamphetamine. People have called this stuff synthetic cocaine. It really doesn't act near as much like cocaine, and not closely related to the molecule. There's a fair amount of difference. Much more closer to methamphetamine. But this and a cocaine overdose were going to look a lot the same. Here's Ivory Fresh for a refreshing, energizing, and truly sensual experience. Where are these sold? Same places, convenience stores, head shops, on the internet. They're usually packaged in little packages like that. And these are normally snorted, so they'll take that little powder and do it into rails like you seen with cocaine. There's the potency is variable. People have tried injecting this stuff, dissolving it, injecting it. It doesn't seem to be real popular, and smoking it doesn't do anything. It just follows the lesson. We started collecting, as we were getting cases and getting confirmation, blood level confirmations, we started collecting data on our cases, and also in collaboration with Kentucky, they were seeing a few cases as well in the subsequent months after us. We were able to publish, this stuff came from a paper we published, and showing what were the common effects that we were seeing from this. Agitation, combative, violent behavior, paranoia, all that stuff, very, very common. And we also noticed CPK elevations in a lot of them because they were just struggling and fighting it so much. We also started looking at cases from all over the country and putting these together and published a few of those. Suicides, bizarre effects, self-mutilation. Everybody's heard about the guy in Florida that was eating the other guy's face off kind of thing. All those kind of deals. But we got enough notoriety for it that the up-to-date people approached us and asked us to write the chapter on bath salts in up-to-date. So Mark and I did that a couple of years ago. So I would commend that if you want to really know more than you ever thought you wanted to know about it, go look at that chapter. Or if you're having trouble sleeping, that would be another time to go read it. It's pretty thick. So I've synthesized the take-home points in the management. Heavy reliance on benzodiazepines. Mostly when these people are struggling and fighting and kicking, you can't get them controlled. The answer is benzos. The question we get from the Poison Center all the time is, well, how much? And the answer is, give it until they quit struggling. When they quit fighting against restraints, then you're out of danger. Because what happens if these people are allowed to continue to struggle, they're going to get hyperthermic, and that's related to mortality. That's when they die. So we give high doses of benzos. I don't even blink till I get to 20 milligrams of Ativan. And worst case scenario, if I have to take care of their airway, take control of it, that's no problem. That's what we do. Sometimes these people have to be put down for longer terms on either Propofol or Precedex. If you got to intubate them, go ahead. I would avoid the antipsychotics in this population. Lots of other issues with that. These people aren't crazy. They're on drugs. People on drugs need benzos. Crazy people need Haldol and Geodon. There have been, although it's not been confirmed, there have been a couple of deaths associated with people getting these type of medications on these bath salts. So I would avoid that. Watch for hyperthermia. You want to avoid that as much as possible, and consider checking the CK on these people because they frequently have elevations. Here's another one of my favorites, white dove. There's a whole dove series, red dove, blue dove. These are some from Louisiana, Bayou Ivory, Hurricane Charlie. You see the local connection there. Here's some from Kentucky. They're known for their bourbon and moonshine, right? White lightning. This is a natural insect repellent. This one's a natural stain remover. This got quite a bit of notoriety. Here's Brian Ross did a story on it and a big expose, and he featured this family. It was one of the tragic stories in the early days of his bath salts that caught a lot of attention. Actually, Mark was interviewed for that story. This is Dickie Sanders, teenager. These are his parents, an internal medicine physician in New Orleans and an emergency physician in New Orleans. And Dickie got a hold of some of this bath salts and was paranoid for several days. The final moments of his life, he was standing in the kitchen looking out the window and saying, Dad, look at all the police cars, all the cop cars, the helicopters are coming. He was seeing all this stuff, and he pulled out a knife on the kitchen counter and slashed his throat. Being physicians that were able to save him from that, took him to the ER, got him stitched up. Dad slept with him in the bed that night. Dickie woke up early, got up, snuck out of the room, and went and put a .22 to his head and killed himself. Still paranoid. So we're just another one of those tragic stories, and you can go on and on about those from this stuff with the severe effects that does. Dr. Oz even got in, did a whole show about it as well. And he had the Sanders parents interviewed on their show. Here's another one, White China. High quality, premium, long-lasting bath salt. Use 1 hour before going out. Extremely stimulating, lots of energy. This is one of my favorites, Seymour's plant food. The reason why I like it is because they give a shout out to the Poison Center. If accidentally ingested, call poison control immediately. I like that. It said you put 8 ounces of water, put 1 packet in 8 ounces of water, give it to 1 adult plant. Over-fertilizing may lead to spoilage of plant or burnout. Trying to give you a little warning there. This is another favorite. All right, let's spend our last few minutes talking about the third epidemic or the third new synthetic drug that's out there. I don't know if anybody's noticed, if you had your head in the sand for the last 15 years, we're in the midst of an opioid epidemic in our country. Since 1999, CDC reports opioid prescriptions have quadrupled. So have deaths from opioids during the same time period. Total from 2000 to 2015, over 500,000 people have died from opioid overdoses. Does anybody have an idea what percent of the world supply of hydrocodone, which is what Lortab, right, the stuff that we give out fairly regularly, what percent of the world's supply of hydrocodone is consumed in North America? 99. 99. You go to other countries, they don't even know what that stuff is. I do a mission trip to Ecuador every year. We've seen thousands of patients. I've never had one ask me for a Lortab or codeine. This is a North American problem. 91 people die a day, and that's probably higher than that now with the most recent stuff going on.
One of the things that this, having lived through it, it seems to me was linked to was best of intentions gone awry and the fifth vital sign.
Yeah.
I don't know if you want to...
Yeah. I actually have a slide about that. But how do we get there?
Yeah.
So it got so bad that for the first time in history, in 2009, actually, drug overdose deaths surpassed traffic fatalities. Prior to that time, every year, the traffic fatalities were always the highest, and in 2009, those lines crossed and have continued to diverge. Traffic fatalities have gone up a little bit, I think, because of distracted driving, but they still haven't surpassed the drug overdose deaths. This is that same time period, all drug overdose deaths, and this is just opioids. You see that every bit of that rise is due to the opioids. So, what have we done to try to control this? And I'll go back and make a point. We got ourselves into this. The JCO making pain the fifth vital sign, me getting dinged as a doctor for not giving people parenteral narcotics out in the waiting room, all those things that led doctors to say, oh, you're being a bad doctor if you're not being really, really liberal with opioids. But it led to that epidemic that was out there, and the prescription opioids that were on the street were just amazing. So finally, in the last few years, recognizing this problem, what have we done? There's tighter restrictions, scheduling restrictions. Just in a year or so ago, hydrocodone, Lortab, got moved to Schedule 2. So now you can't write refills. You have to have a hard prescription. You can't call it in, all those sorts of things. So that's helped. DEA has been cracking down on pill mills and diversion, that sort of stuff. I think one of the most important things that's been combating this whole problem is the prescription monitoring programs that have been developed by almost every state. I think Missouri was the last state, and they're just about to come on board. But this is a database where every controlled substance that's prescription that's done in anybody's name is available to search on a database. And in fact, in Louisiana now, it's illegal to write a prescription for non-cancer pain for somebody for an opioid without checking the PMP first. You're supposed to check that before you give them that prescription. And this has led to a lot of people, a lot of conversations I've had, like, Mr. Jones, I'm sorry I can't give you those pain pills because it looks like you had a prescription for 60 filled 3 days ago. We want to talk about something. So that's helping a lot. A lot of those have come into play. But the unintended consequences of all that is this. As these prescription opioid channels, we've had a whole society of people that are hooked on the opioids. Now, as those channels are drying up, guess what? Street heroin is cheaper. We never saw heroin in Louisiana prior to about 3 years ago. Never even saw it. It was an East Coast, West Coast problem. It was a Chicago problem. We didn't have it in Louisiana. Now it's a common occurrence. So as people are not able to get their Percocets anymore, or their OxyContins, they're going to the streets and finding heroin is cheaper. And now those same people that are making the synthetic cannabinoids and making the bath salts are making synthetic opioids, and they're supplying those to this market that are the heroin chains for profit. So some of the things that we've seen out there, and I'm not going into a detailed list of these, but these are the majority of them. Fentanyl, carfentanil. Fentanyl, you guys know we use fentanyl all the time. It's 100 times more potent than morphine. This is not pharmaceutical grade fentanyl that's been diverted from hospitals. This is stuff that they're making in a lab in China somewhere and sending it over here. This is also illicit carfentanil, you've heard of as the elephant tranquilizer. It's 100 times more potent than fentanyl. There are a number of cases where there's been fatalities in heroin users because they were sold a product they thought was heroin and it ends up being some of these things. Can you imagine if you shoot up your normal amount of what you think is heroin and it's fentanyl? These people are dying left and right on the streets. That's why there's been a big push to sell Narcan over the counter. We have that in Louisiana now. Some of these other stuff you'll hear about as well, W18 and U4770. These are some that are out there. Y'all heard in the news about Prince dying, what was it, last year? So they were found in his apartment or his house, pills that were shaped to look exactly like Lortab. And when they tested them, they were completely fentanyl. So he may well have been killed by somebody who gave him that and didn't let him know what he was dealing with. What key findings with these? Pretty simple. Marked CNS depression. These people are not going to be fighting the kicking and screaming. They're going to be out of it. Depressed respiratory rate, and I'm talking 4 breaths a minute. It's not going to be hard to notice this. They're breathing a few times a minute. And just pinpoint pupils. You see pinpoint pupils, respiratory rate of 6. It's an opioid until proven otherwise. Whether you have anything that shows up on a screen or not. And remember, our screens don't pick up for most synthetics. They're only designed to pick up heroin, morphine, codeine, which are byproducts of heroin. They're not designed to pick up the synthetics. So treat your patient. Treatment is Narcan or naloxone. Many people advocate starting with small doses. They come in a 0.4 milligram vial. Some people even dilute that up. If you just have somebody that's a little bit down, you don't want to cause a withdrawal, they may dilute that in 10 cc's and give even just 1 cc of that at a time. But if you have somebody that's really down, you're pretty sure this is what they got going on, I would start with the small dose or less. And I don't stop until I get to 10 milligrams. That's 25 of those little vials. I had my nurses cursing at me the other day, popping open 25 of those vials and drawing them up. I think we're stocking 2 milligram vials now in the ER. But
10 milligrams total?
Yeah.
Throughout the whole process?
Yeah, starting slow and ramping up, and I don't stop until I've given 10. Because some of these things are they don't respond as well to Narcan. And if you got carfentanil on board, they may take everything you got. So just keep that in mind. Start low and ramp up, and don't stop after you've given just 1 or 2 of those little doses, because you may just need to give more.
The other irony of the epidemic epidemiology of this is that as a fatality occurs in a particular dealer region, that dealer's sales go up.
Well, that's one of the theories, is that if somebody dies, everybody else knows he's got the good stuff.
Right.
Yeah, yeah. It's a weird
Weird market.
phenomenon. And just if you think this is all past, this was in Fox News on their website Tuesday. A new thing called gray death. Called gray death because it looks like kind of concrete. It is being investigated for some deaths in Georgia, Alabama, Ohio, comprised of heroin, fentanyl, carfentanil, and U-47700. All of those combined. So just when you thought it might be safe, they're still going at it, and the law enforcement agencies are scared of this stuff. They think that if they go in, they just get some on their skin, they're going to die. We're trying to reassure them that so far that hadn't shown to happen, but they're worried about it. All right, that is all I have. I hope that's been helpful. We'll take any questions.
What are your thoughts on the new on the injection centers, where people are able to go in and use their heroin without repercussions?
Those things are all they're all been criticized, but the theory is if they're going to do it anyway, let's at least put it in a safe place where they can be monitored and that sort of stuff. People have also been critical of allowing the Narcan to be over the counter. The staunch on one end said that's just Darwin's theory natural selection taking place, let them all kill themselves. Other people say, look, if you can help save one life and get somebody back to being a productive citizen, then that's worth quite a bit of money. So I think that's where hopefully most of us will fall in trying to get these people the help they need and not viewing them as lost.
You know what the primary issue is? It's gotten a lot of press, obviously, Duarte in the Philippines. Is there one particular drug that sort of swept the Philippines that's created that sort of just draconian, if you find a drug user, just kill them approach to life? Or is it multiple things?
I think it's multiple. Yeah, they're westernized enough to be suffering some of the same issues that we are. And plus, all these things are available worldwide now. They're coming from China, Europe, and all that, so they're all over.
Tom, can we look forward to seeing screens for some of these things?
Oh, if there's the question is, are there going to be screens for these? Absolutely, they'll be coming. But if there's money to be made on it, they'll be made. The ideal thing would is if you could have one that would screen for all 300 of those drugs. That costs money and time to produce, but I'm certain they'll be coming down the pipe.
I mean, because we've seen several instances here that have made it to the trial, including the one guy that was on the ventilator for at least 5 days.
Yeah.
And that other guy, I'm sure you remember, the machete.
Yeah.
Machete, the guy just standing in the parking lot, who we were fairly certain had one or more of these things.
So and if there's a criminal activity involved, the state police can send stuff to their crime labs. I have taken several blood samples from some of our patients, and we have a connection with a guy who has a GC mass spec, and he's run some of those for us. So if you have one that it's not something that the police are interested in, and you'd like to get an answer, we can sometimes do that. I can't do that every time because they're getting pounded, but occasionally they'll do one for us. So if you have one that's of interest, let me know. If you save a red top tube, I can do it from that. Last question.
Is the screen coming to like your appointment centers? Is it going to be blood or is it also urine for the synthetic?
Depends on the assay. Ideally it'd be urine because that's pretty easy. Everything comes out in the urine. But it just depends on what product and how they have to make the assay. But I know they're working on them because there's money to be made and that sort of stuff. So we're in America. All right. Thank you very much.